Hello, my name is Dr. Gerald Chodak. Another option in the list of treatments for prostate cancer is cryotherapy. What is cryotherapy? Essentially, it means we're going to freeze the prostate. We're going to put it down to such a low temperature using an argon gas instrument that the cells can no longer survive and then they'll die. And so this is an interesting idea as an alternative way to get rid of prostate cancer. It's actually been around since the 1970s, where people have gone through different forms of treatment, and the latest one, using the latest technology, reports reasonable results in terms of PSA recurrence or PSA success. But what is lacking about cryotherapy is the following. We don't know exactly what 10-year survival rates are. How many men are dying of their disease, how many men are getting metastatic disease, how many men are dying of other causes. We also don't have a lot of good information about patient-reported complications using the standardized questionnaires that are used for many of the other treatments that are available. So it is a treatment option to discuss with your doctor, but at the present time there isn't enough information to compare it long-term to the other treatments available. We don't know what the survival rate is. We don't know what the overall complications rate are. Now, one of the major complications that can occur is impotence. And in fact, it occurs in a high percentage of patients. And that's because as the freezing goes on, it actually freezes the nerves that affect erections, and those nerves may or may not improve over time. So in an attempt to offset this high complication rate, people are looking at something called focal cryotherapy. Now, focal cryotherapy says we're going to give you the treatment. We're going to freeze the area of your prostate where we have identified cancer cells as being present, but we're not going to treat your entire prostate. In that way, we have less chance of injuring the nerves for erections, and thereby we may have an ability to lessen the side effects of the treatment. Now, cryotherapy, focal cryotherapy, is an interesting idea, but it does have the following problem. We know that prostate cancer can occur in more than one area of the prostate. So even though a biopsy is negative in one area does not mean there's no cancer cells present. So the downside of doing focal cryotherapy is that you may not be killing all the cells. The argument being used is to say, well, okay, we'll treat this focal area that we know has cancer, and if the cancer comes back with a biopsy showing up in another area, we'll go in at another time and we'll treat you again. So the idea is we can treat you over and over again in different areas of your prostate. It's an idea that is interesting, but there are many people, many experts around the United States and other countries that say that may not be the best way to treat a cancer that is potentially dangerous. Now, of course, in the United States, we're finding more and more men who have such small cancer that it might not even be life-threatening at all. And for those men, the idea of doing conservative therapy is just not acceptable. They can't accept the idea that they're watching to see if the cancer gets worse. And so in those circumstances, men with minimal cancer, perhaps focal therapy is going to do something to help those men get rid of some of those cancer cells, even though those cells may not be dangerous. So this is quite a controversy at the present time. We certainly don't have 5 and 10 and 15-year results looking at what happens to men that take this focal approach. All we have is PSA results. And even there, we still don't have good outcomes from quality of life surveys telling us what the complications are. It certainly looks like you're less likely to get impotence if you have focal cryotherapy. The real question is it taking care of your cancer, or is it leaving cancer to grow up in the future? And those are questions that can't be answered at the present time. So if you're considering cryotherapy as an option, you want to ask your doctor about their experience and try and get as much as possible information. What is the survival at 10 years? What are the complications from validated surveys that patients fill out and report on their complication rates? These are critical questions so that you're in a position to make a real comparison of cryotherapy compared to the other therapies available. At the present time, there are no good trials underway that will ever answer the question whether or not cryotherapy is as good, better, or worse than the other treatments available. And until we get 5, 10, and even 15-year survival rates, it will be difficult to say for sure if it is as good as the other treatments available. But it certainly is an option for patients to consider. And make sure you ask your doctor about all of the pros and cons, and make sure you've learned about all of the other options available. I hope this information is helpful to you as you make your choice. Thank you.